Welcome back to the Doc Talks. Hopefully, you've been tuning in, listening to some of our banter. And that's what it's going to be today. We're going to banter about creating healthier immune systems and how chiropractic fits into that. And if you're listening in, you may be someone who is thinking about this topic because you have children and you want to help them stay as resilient as possible and adaptable, which comes from having a healthy nervous system and a healthy immune system. Or you may be someone who's unfortunately at a place where you realize my immune system has been burdened and to the point that sometimes it feels like it's working against me. Maybe I've even been diagnosed with an autoimmune situation or label, and I'm aware of my immune system because my immune system may be self-attacking. And to try and really understand more about that can feel really complex. And so we want to have a baseline of just laying out that one of the belief systems we all hold is that our bodies are really intelligent and every symptom is the body's way of communicating. And sometimes we've gotten better at listening to that than other times. And certainly, depending on the messages we heard about our bodies at a younger stage, that may have either supported us learning to listen and trust our bodies, or it may have been like, oh, just cover up, power through, or like, that's normal, but here, take this for it. And so certainly having kids of my own at this stage, really wanting to feed some good messages of learning to listen to your body and giving them positive reinforcement of your body's capable, your body will handle that. So we don't talk about being sick in our family. We may talk about like, you do have a runny nose, your body's getting rid of something. Or isn't it interesting, like you ate that and then you threw up, your body was getting rid of something, right? That a lot of what we've been taught to believe is my body being sick is actually many times actually a body doing what it should do and getting rid of that which shouldn't remain in it. So whether that's coming out the nose, coming out the digestive tract, or you're vomiting or sweating it out, like this is part of how our systems are really intelligent to keep what is meant to be in and what is actually in support of life and health versus also trying to get rid of it. That being said, we all live in a world that has a lot of exposure to a lot of things, and a lot of us haven't been taught this from the baseline necessarily as children. And so we may be learning how to unwind some of this so the body can keep up, right? And we all have a little different threshold, if you will, of how resilient we are and how adaptable we are. And I do believe that isn't a steady state. Like we can make choices that help us become more resilient and adaptable. But Jacob's baseline might not be my baseline, might not be Kelmy's baseline. And that's true for you as well. And it's true for your children, right? So what can we do? I think starting with, like Jacob, if you were giving some just blanket advice of supporting your immune system, what would be some of those tidbits?
Number one's definitely going to be sleep because that's where your body regenerates, it recoups. The deepest parts of sleep is where our body actually turns over our dead or our weakened cells and creates new ones. So I always am a big fan of advocating for sleep because I have personally felt the effects of neglecting sleep, ironically, throughout school. And your body is this detoxifying, self-regulating machine, but you have to give it the fuel and the steps to be able to do that. And the more we work against that, the more our body will bring up symptoms to warn us, hey, this isn't plausible. It's not good for our longevity. And a lot of us, we do listen to those symptoms that are more drastic, but oftentimes our bodies will give us a warning sign that's much less drastic up front that we can probably power through, but it's okay. How long are you going to power through before your body uses the next step up to warn you, hey, we really need to stop doing what we're doing? And I will say sleep is the biggest one for me.
I like that. Like if you have explosive diarrhea, you might not go to work that day. You might take the day off. But if you just have indigestion that's chronic, you might just power through that and not ask the deeper question of what am I putting into my system or how much stress is on me that's taking me out of that rest and digest window. Even with a patient last night, I had brought up to her, I was like, how are you digesting? Because she said, I just went through this really stressful time at work and I could feel in her sacrum how locked up she was, and that wasn't her baseline. I've seen her for years, and she's like, well, I've really struggled. Like it's like I almost realized that I'm not giving myself time to even just like let go, like meaning like sit on the bathroom and let it move through you. And if your body is backed up on all these different fronts, of certainly your immune system is not going to be its most resilient or adaptable either.
For sure.
I would say one of my biggest things that we tend to not think about is water. I know that we always say water, but we also like let it go very easily. Water is how your body's moving things throughout it. And if you're not truly hydrating yourself, things are gonna sit and get sluggish too. So I would say water, very simple, but also huge.
That's great. And you'll probably notice a theme through these talks where we tend to go back to the basics because how many people we see, hundreds of people, that the basics are, we can't skip the basics and just go to like, you can't go from, I didn't get an A in this course and all of a sudden I'm going to go to the 302 level and think that I'm going to do really well in it, right? So we can't hack our way through. Like if we're not getting sleep and we're not getting water, there's not a lot of other things that we can like address first without wanting to make sure that the body has enough fluid to be moving things out to support the immune system. And if we're not getting enough rest and digest, our system's going to be taxed, right? So you're going to hear that over and over again. I would say too, like if you're someone who's like, I know my immune system's been in flight or fight and survival mode for a lot of years, or maybe there was a specific period of time. I was thinking back to another encounter in the last couple of weeks where a woman is having more pain throughout her body. And so she's been coming in more frequently, and we're trying to support her system, of course, through more frequent care. And I just asked her, I was like, just talk to me about your baseline right now. She's just like, I'm just so tired. Right. And I said, and she's someone who's go walks every day, takes her dogs out. And I just said, hey, have you actually let yourself be tired? Like, do you actually let yourself in this season of life? I know you're comparing yourself to probably what was your baseline 5 years ago or 10 years ago, but she's been through a lot of change in her life. Like, have you actually given yourself a season where rest was more important than lots of things, right? And I see this a lot in women who especially are through like have kids, maybe the kids aren't quite as like all encompassing, like they're either launched on their own or they're in a different stage where like there is a little more bandwidth for some self-care, but we're still running like rest is the enemy. And I think back to Jacob's point, that is one of those things where it's like it's okay. And actually your way forward is through actually allowing yourself to have more rest. And then let's see what your body's saying. Right. But we can't, if we don't get that handled, a lot of times we're going to keep seeing other things because the body needs that priority set first.
Yeah. I also think that like when we say rest, we're not only meaning sleep, because we oftentimes don't let like our mental state rest. Like
Sure.
you can't sit and just like do nothing for like 2 minutes. And you should probably practice that because it's definitely a muscle to learn how to be comfortable not filling the mind space.
Yeah. What would be your, if someone was starting, like, okay, that's me, like I have an overactive brain. I don't like, it's common. We hear people say like, I've never slept well, right? So that's usually a pretty good indicator of like, okay, their brain is on nonstop. And then also the body's somewhat agitated. Like, what would be your go-to? Like, okay, let's try this. Here's the baby step to start to program yourself to like, it's okay to shut the mind off a bit.
I would say like meditation is huge, but if you're the person where it's like, I've tried meditating, it's so boring, I would start with something like a body scan. Like you can literally just YouTube body scan, meditative body scan, and see how it feels. Because it is more of like an active meditation, so you might feel productive, but that's also what we're trying to like not need to do. So I would start there, and it can be like a 1 to 2 minute thing too. If you're like, I just don't have time to not think, I would start there and see how it feels.
Yep. And sometimes having someone hold you accountable to those things until you can learn your own muscle of doing it is really helpful. So whether that is going to like bowls where someone plays singing bowls or something and you listen and you just lay there, right? That could be an example. Or we all just did trauma release exercises with Carla Cooper at the Zanya Center, which you take your body through a series of fatiguing things and then you lay and let your body go through a release, but you're not doing anything during that time. You're just letting your body do that. Like sometimes having someone hold space for you to just, I'm putting this on my calendar that at 1:30 the priority is actually to rest for a little bit is sometimes what has to happen. It's like, this is non-negotiable. It's fitting in my week. And I know I have other things I could be doing, but this is the most important, which is clearing out for a moment.
Yeah. I would say to go off of what Cami said, there's some simple things you can do that are drastic in the effects that they'll have on not just your mood, but your energy, but your also like virality, the actual energy you're pulsating out into the environment that surrounds you. A big one for me is like actual verbal and out loud affirmation to yourself.
So good.
So looking at yourself in the mirror and saying whatever it is you're struggling with and verbalizing the opposite and saying that out loud has such a positive effect on your mind because our mind is so efficient at creating these riffs when we don't speak or we don't say things out loud. One example I like to make is if you read something out loud versus read it in your head, you can read a lot more efficiently in your head because your body and your mind is so quick at making that process more efficient. So the more we work against those negative tones in our body and in our system, and we verbalize them out loud with positive recognition, your body has to process that. It physically does. And it has such a great attraction force to what comes next in your life. So a big one for me is just saying like, I'm enough in the mirror.
Mm-hmm.
Doing that 10 times out loud to start your day. And just do it consistently. Don't do it once. Do it for like a month. And then what did you feel different that month? What came along your path? What changed?
Right. And the vulnerability to do that, like Jacob just saying that out loud, right, is half the reason why people don't do that, right? They don't slow down enough to think about what is the negative self-talk. Let's say it is about rest. Like rest isn't, I don't have time for rest. I don't have time for that, right? Well, an affirmation would be like, actually, the biggest and best use of my time is to make sure that I'm taking good care of myself. It could be a way of affirming that to yourself, even if it doesn't feel true. A lot of times there's a way we can say affirmations where it's not like a knee jerk, like, I'm lying, right? Like, it's like sometimes if the opposite is what you would like, but it feels like too big of a stretch, even just saying, like, in the past, this was true for me, and now I'm choosing to change it, right? So much of the work that we have to do in transformation and healing is a combined effort between, yes, physically what we're choosing to do, and then mentally and emotionally and spiritually, how we let that conceptualize in our thought pattern, and then how we put more effort and energy behind it.
Like you were saying, I think if you're in a place where like negativity is the main space, jumping to positivity, sometimes the brain is going to deny that. Like it's going to be like, I said that, but I still don't believe it. And then you're going to look for things that affirm the negative because confirmation bias, it's a real thing. So even taking one step to more of a neutral place is still a step in the right direction. So just being patient with yourself because it can feel very hard and uncomfortable. And you might want to even prove yourself wrong if you're jumping straight to the positive. So even trying to just tell yourself, like, I am a human being. And there's so much that entails with that, but you would treat another human being with respect. So treating yourself with respect is a step in the right direction.
Yes, I think when we look at like the deeper underpinnings of the immune system that's starting to self-attack, I would say most of the time there's either a lot of things that have been very self-critical or not supportive in how we've learned to take care of ourselves or at least pay attention to ourselves, right? And so it is going to feel likely like we're stepping into uncharted territories to rewire and to choose that which is nourishing and supportive and restful. And Cami, you said this too, of like, sometimes rest, it might not be sleep. It may be sleep, but it also may be things like, I usually push my body. Let's just say you've always worked out really hard and you're starting to experience a lot of pain, or maybe the pain's been going on for a long time, or breakdown in tissue, or you're just not getting the results that you want. And you move into a season, maybe it's a quarter where you're like, I'm just going to walk and I'm going to like just let my breath come a little deeper into my body. And I'm not going to judge my production in my workout based off of like me hitting a certain number of run miles or whatever. That would be rest as well. Like you're just doing something different for your system that is more nourishing. And certainly when our immune system is already heightened, that can be really important.
Yeah. And bringing it back to like autoimmune as a topic, the body is attacking itself for a reason. So I think when we look at the body and that it's doing something wrong, or it's just not agreeing with me, or I wish it would do something different, I think also trying to have some respect for the body in the sense that it is trying to protect you and what it's doing is for a reason. Even looking at your body in that light can be helpful.
Yeah. The last piece of this, if like we think about chiropractic, well, how does chiropractic fit in across the board, right? Whether that's I have little kids and I want to just support their nervous system and support their immune system versus also like someone who's like, I know I got a lot of work to do to potentially unwind some of what's going on with my body. Why does chiropractic support both? And that's because if we have a more balanced and supported nervous system, brain, spinal cord, and how the nerves flow out to the tissues, and where our body is more readily able to read its environment and respond appropriately versus maybe when it's in a flight or fight, always responding like I'm in flight or fight, our systems are going to gain back some of that adaptability and that resiliency again, which should show up not only in the tone of the body and what we're feeling when you're on the table and how much ease is maybe present in certain areas that maybe wasn't there before, but it will be a process of unwinding and supporting your system so that we can help you have a leg up in your ability to be resilient.
Yeah. And we have a few patients that do find relief. We have numerous patients with psoriasis, for example, that under care, they've found that their plaques have went down, which is amazing. And they've tried everything under the sun, and this is the thing that helps them. So it is amazing what your body can do when it's given the proper tools to do so.
That's a great example too, when you think about, okay, if the body's always just using like its resources it has to get whatever job needs to be done. Let's use the skin as an example, right? Where psoriasis is showing up. Like the skin is actually the body's like barrier for things coming in and out, but it's a way for things to go out too, right? So it's one of the ways that our bodies will rid itself of toxins. Let's just say if the gut isn't doing the full job or the organs in the detoxification process aren't able to get everything out because there's maybe too much of a toxic load, whether that's present or just from the past that it's still trying to work through, we'll see that the skin is showing a lot more like issues on the skin, whether that's rashes or psoriasis, that type of thing. So now we go in and we start adjusting, we start unwinding. That organ system, that digestive tract is working at a little higher function, is able to keep up a little bit more. Now the like load on the skin isn't quite as heavy. All of a sudden, you didn't maybe think chiropractic had anything to do with your psoriasis because how is your spine connected to your skin? But it's because that clearinghouse of how the body is going to prioritize how am we going to get the job done here works just a little more efficiently, right?
Yeah. I'd offer a different perspective to adjunct to what Dr. Lona just said. It was actually a podcast I was listening to this morning, and it was talking about if when our kids get sick, that they have a fever more often than not. And for example, let's just say a common cold with an elevated fever. If we give that kid medication, yes, will that bring the fever down, but did it solve the issue? Maybe not necessarily, but the person speaking on the podcast offered a different perspective of if that kid was technically healthy, quote unquote, or did not have a fever, and then we also offered them cough medication, would that parent not be looked at in a negative light? I would think more often than not. So it's just looking at things with a different perspective, right? And allowing your body to heal itself and listen to the inflammatory responses that it's using. A fever is an elevated temperature within the body to kill said virality or bacteria within the body. So it's not necessarily a wrong thing, although society may have shown us that. And I will say, one thing a mentor told me is that delayed gratification is the measure of maturity. And I think the older I get, I think that becomes more and more true. And I feel like the more we can be a leader to provide said delayed gratification to our kids or whoever's looking up to us, because every one of us is a leader, no matter what position we are in, there's someone looking at you and looking up to you. I think the better we're going to be as a whole. So
in this case, like we want quick fixes, but quick fixes usually lead to actually more discomfort generally down the road, in my experience anyway. So to your point with the fever as an example, like what I've seen in my kids is they may ramp a fever and we're watching it, but they're able to like still go about, like maybe they're watching a movie or maybe they're able to keep fluids down or something like that. Yes, in the short run, not so fun. They don't feel good, what have you. But the bounce back is so much quicker than many times if we reduce that fever, delayed how long that child had to work to clear things out because we've reduced that innate response. Many times that child's immune system now has not gotten to respond the way that it was designed to, which leads to sometimes that not only in that run being a little bit longer, but also now what happens the next time they come encounter with that same thing, we start to rely on these external resources, which most of us, we hear from parents too, don't want to feel like they're constantly putting their kids on antibiotics or they're constantly taking cough syrup or things like that, right? So they're looking for a more natural option. It just comes from sometimes having to sit with, this is an uncomfortable moment right now. And I'm watching and I'm aware I'm not negligent, but I'm also trusting that I will know through my intuition and what I'm watching in my child whether we really need to go in and reduce this, or actually this is just a normal process right now. They're still maybe irritable, but okay. And I can give them a popsicle, hopefully not with a ton of colors, and support their system to just get through this and then actually build their immune system, which is what we're all looking to do, is to have a very strong immune system in a way that knows what it should respond against and also is aware of its external and internal surroundings and what it doesn't need to respond to. So, all right, guys, we'll listen into our next one. We'll see you then.